Have you ever found yourself running to the bathroom more often than usual? Today, we dive into 3 conditions that might be the cause: polyuria, frequency, and incontinence. Imagine a tap that's left open. The water keeps flowing, right? This is quite similar to polyuria, a condition where the body produces abnormally large amounts of urine, more than 3 liters a day in adults. It's like your body's tap is left open and you're producing more urine than usual. Now, let's consider another scenario. You're at a party, enjoying the music and conversations, but you find yourself excusing yourself to use the restroom more often than you'd like. This might be due to frequency. Frequency refers to the need to urinate more often than usual. It doesn't mean you're necessarily producing more urine like in polyuria, but rather that your trips to the bathroom are more frequent. Lastly, let's discuss a slightly more sensitive topic: incontinence. Imagine you're in a funny situation and you laugh so hard that you lose control and have a small accident. This is a form of incontinence, a condition where you lose control over your urinary bladder. It can happen when you cough, sneeze, laugh, or during other physical activities. It can also occur suddenly without any particular reason. This condition is more common than you might think and affects people of all ages. All 3 conditions, polyuria, frequency, and incontinence, can disrupt your daily life and might be symptoms of an underlying health issue. It's important to understand that if you're experiencing any of these symptoms, you're not alone and there's help available. Now that we understand what these conditions are, let's delve deeper into each one and find out more. First on our list is polyuria, a condition where you produce abnormally large volumes of urine. Polyuria is a medical term used to describe excessive or abnormal urine production. It's not merely a case of frequent trips to the bathroom. We're talking about outputting more than 3 liters of urine in a day, which is quite a lot, considering the average person expels about 1 to 2 liters. Now that we have an idea of what polyuria is, let's delve into its symptoms. The most prominent and telltale sign of polyuria is, of course, producing large amounts of urine. This typically leads to increased frequency of urination even at night, which is known as nocturia. Other symptoms could include excessive thirst, also termed as polydipsia, and in some cases unusual levels of fatigue may be experienced. So, what causes this excessive urination? Polyuria can be a symptom of a variety of conditions, but the most common culprits are diabetes mellitus and diabetes insipidus. Diabetes mellitus involves high blood sugar levels causing your kidneys to work overtime to remove excess sugar from your blood, resulting in more urine production. On the other hand, diabetes insipidus is a rare condition where your kidneys can't conserve water due to a lack of the hormone vasopressin, leading to frequent urination. Other potential causes of polyuria include certain medications like diuretics used to help eliminate fluid from your body, and conditions like hypercalcemia, which is an abnormally high level of calcium in the blood. It can also be a result of consuming too much caffeine or alcohol, which have diuretic properties. Now let's talk about the general treatment options for polyuria. Treatment usually involves addressing the underlying cause. For instance, if diabetes is the source of the problem, managing blood sugar levels could help reduce symptoms. If medication is the cause, your healthcare provider might adjust your dosage or suggest an alternative. It's essential to consult with a healthcare professional who can provide advice tailored to your specific situation. In terms of lifestyle adaptations, staying hydrated is key, especially if you're losing a lot of fluid through urination. However, it's also important not to overhydrate, as this can exacerbate the problem. Balancing your fluid intake based on your urine output and other factors like your activity level is crucial. While polyuria might seem daunting, it is manageable with the right treatment and lifestyle adaptations. Understanding the condition is the first step towards managing it effectively. So let's continue this journey of understanding together as we move on to our next topic in this series. Next up is frequency, a condition characterized by needing to urinate more often than usual. Let's dive right into the heart of the matter. Frequency isn't just about making more trips to the bathroom, it's about a persistent urge, a constant call from nature that can disrupt sleep, work, and even leisure activities. It's like having a pesky alarm clock that just won't quit. But what causes this incessant need to go? Well, it's not always as clear-cut as you might think. There are several potential causes. It could be due to an overactive bladder, a condition where the bladder can't hold as much urine as it should. Or it might be due to a urinary tract infection, where bacteria invade and irritate the urinary tract, making you feel like you need to go all the time. Diabetes, bladder stones, and certain medications can also lead to frequency. In women, pregnancy and menopause can cause frequency due to hormonal changes and pressure on the bladder. In men, an enlarged prostate can press against the bladder, triggering the need to urinate more often. Now let's talk about symptoms. Aside from the obvious, needing to urinate more often, frequency can also be accompanied by other symptoms. These may include a strong, sudden urge to urinate, discomfort or pain while urinating, and sometimes even a loss of bladder control. If you're experiencing any of these symptoms, it's important to consult with a healthcare provider. So, what can you do if you're dealing with frequency? Well, the good news is that there are several treatment options available. The best treatment for you will depend on the underlying cause of your frequency. This is why it's so crucial to have a thorough checkup and to discuss your symptoms openly with your healthcare provider. For some, lifestyle changes might be the first line of defense. This could include reducing your intake of liquids before bed, avoiding caffeine and alcohol, or doing pelvic floor exercises to strengthen your bladder control. If lifestyle changes aren't enough, medication might be an option. There are drugs that can help to relax an overactive bladder or reduce the size of an enlarged prostate. For some people, a combination of lifestyle changes and medication is the most effective treatment. In more severe cases, surgery might be considered, but remember, everyone's body is different and what works for one person might not work for another. It's all about finding the right solution for you. In conclusion, frequency is more than just an inconvenience. It can be a sign of underlying health issues and can significantly impact your quality of life. However, with the right care and treatment, it can be managed effectively. Frequency can disrupt your daily life, but understanding it is the first step to managing it effectively. So don't let frequency control your life, take control of it. Finally, we have incontinence, a lack of voluntary control over urination or defecation. Incontinence, quite simply, is when you can't control your pee or poop. It's not something most of us want to talk about at dinner parties, but it's a reality for many people and it's important to understand it. The symptoms of incontinence can vary. Some people experience occasional minor leaks or dribbles, while others may lose small to moderate amounts of urine more frequently. It's not just about frequency though, it's also about unpredictability. That's the key issue here, not being able to control when you go. Now let's talk about the causes. They're pretty diverse and understanding them can help demystify the condition. Incontinence can be caused by everyday habits, underlying medical conditions, or physical problems. A thorough evaluation by your doctor can help determine what's behind your incontinence. One common cause is a urinary tract infection, which can irritate your bladder, causing strong urges to urinate. Another cause is constipation. The rectum is located near the bladder and shared many of the same nerves. Hard, compacted stool in your rectum causes these nerves to be overactive and increase urinary frequency. In women, physical changes resulting from pregnancy, childbirth, and menopause can cause stress incontinence. In men, prostate gland problems are a common cause. Neurological disorders like multiple sclerosis, Parkinson's disease, stroke, and a spinal injury can interfere with nerve signals involved in bladder control, causing urinary incontinence. So, what can we do about incontinence? Well, the good news is that treatments are available, and they can be very effective. Your doctor might recommend managing incontinence with a combination of treatments, which can include medications, physical therapy, and sometimes surgery. Medications can calm an overactive bladder, or they can help you empty your bladder more fully during urination. Some medications can also help tighten muscles and block nerve signals that cause incontinence. Physical therapy can include pelvic muscle exercises, often known as Kegel exercises, which strengthen the muscles that help control urination. Electrical stimulation might be used to strengthen the muscles too. In more severe cases, surgery might be recommended. Procedures can improve incontinence by repairing bladder or sphincter muscles or supporting the bladder neck. Remember, there's no need to be embarrassed. If you're experiencing incontinence, it's important to talk to your doctor about it. They can help you understand what's happening and guide you towards the best treatment for your individual situation. Incontinence might be embarrassing to talk about, but it's more common than you might think, and there are ways to manage it. Don't let a little pee or poop get in the way of living your life to the fullest. So how are polyuria, frequency, and incontinence related? Well, it's interesting to see how these three conditions intersect and diverge. All three are related to how the body handles urine, but they each have unique characteristics. Let's start with polyuria, which is characterized by the production of unusually large volumes of urine. This can lead to frequency, the need to urinate often, simply because there's more urine to expel. Now, frequency isn't always caused by polyuria. Sometimes the bladder becomes overactive, creating the urge to urinate more often even if the volume of urine isn't necessarily high. This overactivity can be due to various reasons such as bladder infection, certain medications, or even conditions like diabetes. Incontinence, on the other hand, is a loss of control over urination. This can happen in conjunction with both polyuria and frequency. If the body is producing a lot of urine and the urge to urinate is frequent, it might be harder to maintain control. However, incontinence can also occur independently, due to factors like weakened pelvic muscles, nerve damage, or as a side effect of certain surgeries. Now let's talk about how one condition may exacerbate the others. Polyuria, by producing large amounts of urine, can increase the frequency of urination and the risk of incontinence. Similarly, frequency can exacerbate incontinence by putting constant pressure on the bladder and pelvic muscles, making it harder to maintain control. However, it's important to remember that these conditions can also exist independently. Someone might have polyuria without experiencing frequency or incontinence. Similarly, a person might experience frequency without having polyuria or incontinence. And someone might struggle with incontinence without dealing with either of the other two conditions. In essence, these three conditions are interconnected, but they are also distinct in their own right. Recognizing the overlaps and differences can be crucial in managing symptoms and seeking appropriate treatment. It's always important to have open, honest conversations with healthcare professionals about any urinary issues you're experiencing. Understanding these conditions individually and in relation to each other can help you manage symptoms and seek appropriate treatment. In the past 15 minutes, we've taken a deep dive into polyuria, frequency, and incontinence. We've journeyed through the labyrinth of these conditions, unpacking their complexities, and making sense of their symptoms, causes, and treatment options. Let's take a moment to summarize what we've learned. Polyuria, which is the condition of producing unusually large volumes of urine, can be caused by factors such as diabetes, certain medications, and even excessive caffeine or alcohol intake. The symptoms are pretty clear-cut. If you find yourself producing more than 3 liters of urine a day for several days in a row, you might be dealing with polyuria. Next, we discussed frequency, the need to urinate more often than usual. This can be a result of urinary tract infections, an enlarged prostate in men, or bladder problems. If you're finding yourself making frequent trips to the restroom, especially at night, frequency could be the culprit. Then we delved into incontinence, the loss of bladder control. This can be an embarrassing condition, but it's more common than you might think, and can be caused by factors like aging, childbirth, and certain neurological disorders. Symptoms can range from occasional leaking when you cough or sneeze, to having an urge to urinate that's so sudden and strong you don't get to a toilet in time. For each of these conditions, we outlined a variety of treatment options. From lifestyle changes like reducing caffeine intake for polyuria, to medications and pelvic floor exercises for incontinence. We also noted the importance of consulting with a healthcare professional who can provide a diagnosis and guide you towards the most effective treatment plan. In closing, we've learned that these conditions, polyuria, frequency, and incontinence, are more than just inconveniences. They can be signs of underlying health issues. Knowledge is power, and understanding these conditions is the first step towards managing them. Remember, if you're experiencing any of these symptoms, it's important to consult a healthcare professional. Thank you for watching.